In terms of mental health is really broad.
What healthy lifestyle would you advise us to adopt so that we don't feel overwhelmed or feel guilty? We find ourselves in a time whereby knowledge is everywhere. You have ChatGPT, you have Google. At what point do we call the line between being informed and being misinformed for our health choice? Hello, everyone, and welcome to another edition of Talk Your Mind. I am Alex Oge, and today we'll be talking about health. As you know, Talk Your Mind is a podcast where you just air your mind. There are no filters, there are no holds back. So today we'll be talking about health, and you know that health is not basically about the absence of disease, but it is living a productive life without hassles, without stress. So basically, we meet today in the studio. We have Dr. Peter Itebime. Dr. Peter is a medical doctor practicing here in Benin City, and we'll be doing a lot of discussions as regards health-related issues together. Over to you, Dr. Peter. Please introduce yourself.
Okay. My name is Dr. Peter Itebime. I'm a medical doctor here in Benin. Like my host rightly said, being healthy is not just abstinence. It's not just having a disease. Being healthy is when it comes to health, there is physical health, there is mental health, there is social health. So being healthy in general encompasses all these parameters. So we hope as you listen, by the time we are done, you'll be better off and you'll be able to learn a thing or two about staying healthy and living a healthy life. Thank you.
Okay, Dr. Peter. So welcome. Something has been bothering me basically, though. With the world that we live in currently, you discover that we have a lot of fast food. People now depend on fast food. They now depend on junks. They now do a lot of unhealthy things just to keep up with the trends of things that are happening. So, as a doctor, what would you advise? What healthy lifestyle would you advise us to adopt so that we don't feel overwhelmed or feel guilty?
Okay. Thank you very much. I think that's a very, very interesting question. Um, it's true. Like since recently, we've been based on we've been trying to adopt modern lifestyle because of the influence of Western society on us. Even most people now they are more sedentary. Like they don't do exercise as much as they used to. In the past, our forefathers, our grandparents, and all they used to farm. They used to engage in a lot of exercises that keep them fit. So in terms of that, like most of our food now contains fats and oil. Most of them are unhealthy. They contain high cholesterol, which is implicated in a lot of diseases such as cardiovascular diseases, such as diabetes, hypertension, and so on and so forth. Even implicated in stroke. So um, so these food they are not common in compared to before. So like I think we should instead of adopting those lifestyle that always eating those food we can do with exercise, then try and eat healthy. There are a lot of healthy lifestyle that we can implement. If you want to eat those things, those food, I think it's better when you eat it few times. You try it maybe in between. There are even people that exercise, they do have this escape where they just try and eat something just because they want to eat it. Or when you eat those meals, you eat it in little quantity. You understand? So when but other lifestyles are important that we could adopt exercise, regular exercises, then eating of fruits, then even reduction of salt intake. Yeah, because among Western, like among Africans, they discovered that our body absorb more salt than Caucasians. So because of that, we're more likely to have hypertension and diabetes. So so that's that. Then I think I think that's for it for now.
Okay. So adopting a healthy lifestyle,
Yes,
taking in less salt, exercising more can help in living a healthier lifestyle. But you know, these things are very difficult to, they are easy to say, but very difficult
to
to
adopt.
do. So what will you advise? What practical steps can somebody take to be able to adopt this healthy lifestyle?
Yes. First thing first, I think most people like society we like if we're not sick, you don't go to the hospital. Sometimes I see patients that are already in their 50s or 60s, they'll tell you that they've not been to the hospital before. You don't have to be sick to go to the hospital. Sometimes if you go and check your blood pressure, if you go and check you if you have sugar, most times most of these places they have those things. The first time they will present to the hospital, they come down with hemorrhagic stroke or so. So I think one other thing aside those lifestyle changes, they they should we should try and as much as possible to just go to hospital for routine check our blood pressure, check our sugar, you understand, do our cholesterol test, you understand. Because some persons just assume that because you are slim, because you have a lean body mass, means that you are healthy. It's not, or because you are real stand. So lean body mass sometimes are even implicated in diabetes these days because of the importance of skeletal muscle in the production of in glucose metabolism. So those people that are muscular, they are less likely to have diabetes than people that are very slim. So because you are slim does not mean you are healthy. So we should adopt the lifestyle where we do routine checkup, like routine checkup of blood pressure, your sugar, do routine tests, check your kidneys, check your liver, check your heart. You understand? When those things are healthy, then especially when there's a family risk, family history. Let's say your dad, your mom is hypertensive, is diabetic. You understand? You should be more aware of those risks. And you should even try as much as possible to start those lifestyle changes that I mentioned before, like those exercises, those dietary controls, reduction of salt, eating food that are good in. If you want to take food that are rich in omega 3, omega 6, avoid food that have bad cholesterol, and all those things.
So you just made mention of something now, not in my question, but I just wanted to ask about it. You said people who are more muscular are at less risk of having diabetes. I want you to expand on that. Yeah.
Yeah. Okay. So studies have shown that like insulin, because insulin is what causes insulin is what causes diabetes. So diabetes there are different types, but basically the most common ones are type 1 and type 2. Type 1 is when the insulin is finished, like there is no insulin to be able to do its function. What insulin does is when you eat food, the food is broken down to produce for glucose. So what insulin does, insulin is now secreted to push those glucose into the cell for the body to use. So when insulin is defective, when insulin is not there, or when insulin receptors are not active, what happens is those glucose they will now be so much in the blood because they are unable to get into the cell. Is what they say like starve in the midst of plenty. So for type 2, what happens is the receptors are not working for whatever reason. The insulin is there, but the receptors does not act. So those functions are not there. But the studies have discovered that skeletal muscles they are important for they're important for glucose metabolism. What it means is when insulin when insulin is produced, insulin causes this absorption of glucose into the cells. Most important cells are muscles. So they are stored in muscles. You understand? They are stored in muscles as glycogen. They are used up in muscle cells too. So people that have lean muscles, they don't have muscles to keep glucose. What happens with them? The glucose don't have anywhere to be.
So
That's
invariably,
just
people should work on having more muscles
yes,
so that they can maintain or keep the sugar.
yes.
Do you understand? Makes sense. That's cool. Okay, so our next question is on mental health. We find ourselves in a community whereby we don't believe that people really do have mental health issues in Nigeria, maybe based on the fact that due to our environment, how we grew up, what we're told, and all that. The only time we can say somebody has a mental health issue is when they are already on the streets, when somebody is raving mad. That's when they can say, okay, this person gets colo mental or a day colo or something. So now, my question is, how do we, at what point do we know that we have mental health issues, right? And we need help. Do you get?
Yes.
At what point can somebody say, "Oh, this is not the way I behave, or I'm getting depressed, or I'm emotionally down, or my emotions are not as regular, or there is a break." Do you understand? At what point do you know that issues are coming up and I need help?
That's a very lovely question. Thank you. In terms of mental health is really broad. You understand? There is mental health of emotions, like the one you mentioned, depression, mania. And when you are depressed, it means when your mood is very low, when you're not excited about things that you're excited in the past, when you find it difficult to get up from bed early in the morning, when you don't enjoy what you previously enjoyed before. Sometimes it might even lead to you're not able to eat that appetite for food. You don't want to eat anything. Sometimes it could even translate that you're eating a lot. You're just eating excessively. So that's depression. So there is the flip side where we call it mania, manic episode. That's when the person is overexcited over things that are not supposed to be. The person has so much energy. You understand? The person is so full. The person cannot sleep. Find it difficult to sleep. It's all over the place. You see the person before that is used to be very composed, very calm. He's now doing everything. He's now becoming too religious. Now preaching everywhere. So much energy. Fine. I'm not saying anybody that's religious has a mental issue, but I'm just saying the sudden change of behavior of someone that is very reclusive, that is very that keeps to himself, becomes so excited, so elated all the time. Like, so that could be that's called mania. Where then there is also the bipolar, those that are of opposite flank, where sometimes they are depressed, they are so low. The next time they are overexcited, the next time they are depressed again. So then those are disorders of emotion. There are others like with schizophrenia, those who are the common ones we usually see that we consider as mentally ill, those ones that we see on the street. For depression is very common, more common than we think. Yeah, and most people just have this idea that when you, for why will you be depressed? Yeah, and why should you be sad? You understand? Like you are living, some people are dead. You don't even have any, maybe you're not sick. You don't have any physical illness. You understand? You don't have any. You've not lost a loved ones, or even if you've lost a loved ones. So why should you be depressed? There is more to life, but depression is more than that.
Because I discover over time that people blame you for being depressed. People blame you for having mental health issues. They will want to, even to the extent of people that already committed suicide, they blame them for committing suicide. In as much as people are trying to say a lot of things while they were alive, but there was nobody listening. So my question is, how can we sane people help mental health people? People with mental health issue, our friends, our families, how can we be there for them? How can we help them? When we discover that, okay, I have a friend that has mental health issues, how can I help them? Where can I even take them to? Because personally, I had a friend that got into substance abuse and it affected him seriously, right? And I tried over time to help. I showed him as much love as I could, to the extent I was even giving him money. I know that this money, we want to say go do something, but I will still give him the money just to show that I am there. Because a lot of my friends already knew that, oh, this one, any money you give him more, are drugs. But it became an issue for him, right? Because most of the times when they discover that there is nobody for me anymore, that's when they tend to take their life. But if they say, okay, this person did for me, so anytime he comes, I give him money, right? But I really don't know how can I help this person. I talked about him, I spoke to him about going for rehab. But where are the rehabs in Benin City especially? Do you understand?
Yeah,
So how do we help these people?
that's a lovely question. In terms of like your friend, in your friend's case, for instance, the I think he would do well going to rehab. And the rehab, what it will do for him is because normally when substance abuse is a big area, and it's becoming more common as there are more substances in our society now. There are a lot of them. You meet a lot of patients. They'll tell you, "What do you take? I take this. I take that. I take this." The names are like they have lost count. Yes, and most times, sometimes it gets to a point where those people they even want to stop. You understand? Stopping itself is also a very big issue because when they stop these medications, because those medications have impact on the brain, most of them tend to cause they are like our emotions, they are controlled by hormones. You understand? Hormones that are in the brain. We call them neurotransmitters, like the serotonin, the dopamines. Those hormones, they are love hormones, are happy hormones. They are what creates this euphoria that most people that take drugs they get. So when they stop taking these substances, they have anhedonia, they have depression, they have different emotions. The withdrawal effect of drugs, be it opioid, be it any other type of active substance. That withdrawal is so difficult where most of them feel like they literally want to die. So before you know it, they will want those quick fixes again, and they will be desperate to get those drugs. They'll beg you for it. So even rehabilitation is, yeah, rehabilitation has shown to help, but for rehabilitation to actually help, we need our friends, our family. They will also need the patient itself to be able to come together and be like, okay, fine. At this point in time, I want to stop. You understand? No matter the cost, I want to change my life. Yeah, I want to be better. You understand? I want to be able to decide my future. Like I want to set up. I want to do something different. So whether we have the family, we have the friends, which are very key. You understand? Because sometimes it gets to a point where they are in so deep that they need those people, they need the loved ones and family, loved ones to be able to act, take the person to a rehabilitation center. I think the Oselo Psychiatric Center, they do rehabilitation there. I think there is another one, I can't recall the name right now. Yeah, so the rehabilitation center, what they do basically is they place the patient on antipsychotic drugs. But the most important thing is that keeping the patient away from taking those substances. You understand? So that because there is a phase the patient goes through, like when the patient is not taking those drugs, it gets to the point where the patient start begging, start craving, start feeling like losing his sanity. You understand? So, but after some time, after a very long time, it improves. Then, so it takes some time. It takes a month, 2 months, 3 months. Yeah, but at the end of the day, is the result at the end that matters. But the patient has to come because even if you do rehabilitation and after waiting, patient goes back, falls back to its old sin, you also start all over again.
So is it that all mental health issues need to go to a rehab or to see a psychiatrist? Does all mental health issues, because earlier you mentioned all the various types of mental health, the emotional, the still the what's bipolar and the others and others and others. Does all of them, do they have to see a psychiatrist or go to rehab?
Um, I don't think all mental health condition need to say don't to see the doctor, but sometimes they might. You understand? Like even if they see the doctor, all of them don't need to be rehabilitated. All of them don't need to be admitted. All of them don't need to be, excuse me, all of them don't need to be treated. Some of them just need reassurance. You know, you just need to see the doctor. The doctor will tell you, okay, this. They just need follow up care to make sure that like they are on track. Some of them might need to be admitted. You understand? Those with active psychosis, those with severe depression that are life threatening, that maybe could harm themselves or could harm others. You understand? Or those with schizophrenia.
The mental health issue will go on, will go on and on and on and on and on. But let's move on to my next question, my last question for today. Um, we find ourselves in a time whereby knowledge is everywhere.
Yeah.
You have ChatGPT, you have Google, you have various AIs, both for health and all that. And many people have relied on the information from from these machines for their health. At what point do we call the line between being informed and being misinformed for our health choices?
That's a very, very important question. We see that we see
Because
these
I know
cases.
before you continue, because I know that several times you tell me somebody before a patient comes to the hospital, they must have gone through ChatGPT. When you're telling them to go and do this, they'll tell you, but you are supposed to do this. Hemoglobin, start calling English, calling names. I remember once I had that discussion,
Yeah.
and you're like, man, this thing is just so just.
Mhm. Thank you very much. So the that's a very, very interesting question in the sense that these days, because of social media influences, because of those AIs and all, most persons are informed about their health. They have headache, they'll go and check causes of headache, space occupied lesion, tumor this one that, this one this, or they have the chest pain, they go and check heart attack, cardiac arrest, angina, this one, that one. They have leg pain, oh DVT, blah blah blah. Like they usually check those things. Of course, it's important, and like they it's important to be informed, but most times, based because they don't have the medical experience, medical knowledge, they when they check those things, they usually come with anxiety. They're usually so scared. You know, they see everything and they just assume that it could be this, it could be that, it could be this. Whereas probably what they have is just a benign, just something that will just require maybe it's costochondritis, maybe they have chest pain, maybe it's just costochondritis, they just have a superficial pain in the cartilages or in muscular pain. Then they just feel it, they just feel it, they feel, are you sure it's not pneumonia? Are you sure it's not pleural effusion? Are you sure it's not pleuritis, pleurisy? Are you sure it's not TB? You understand? So why those things are important? Misinformation is also common because of the lack of knowledge and the lack of direction. So coming to the hospital, seeing the doctor, that's very important because based on your complaint, yes, that we are there to make sure that if it's something serious, we'll let you know. This looks serious. So why not do this test?
Yeah.
You understand? If it's not so serious, we'll still tell them like this is nothing so serious. You understand? Because when you check your symptoms, hmm, you'll see things that you'll see things that would really, really shock you. And most times it comes with hysteria. But most times it's not really a good look. But it's also important to, like you said, drawing the line where you can check and have an idea. Or maybe you come to see the doctor. The doctor tells you, Madam, with this your complaint, with this test, this is that you did, this is what it is. You can Google your symptoms. You can Google your diagnosis and be like, okay, fine, sir, I've just checked it out. They said it's this, that, 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 that. What does this mean? Is this something that will kill me? Is it something that is so serious? What do I need to do? Do I need to come for follow up? Do I need, is this still terrible? Is this something I have to live with? You understand? So those are important, important areas. So
Thank you so much, Dr. Peter,
you're
for
welcome.
coming. Thank you so much for being a part of today's session.
Thank you very
So
much.
remember, guys, that good health is not by chance, it is by choice. Live healthy and live hopeful. See you next time.